So this is the way that you're going to get into the Aemulus-XR demo app. So you're going to hit your navigator, and that's going to bring up this screen. If you don't see a library, then you want to press this 3x3 library. Again, I'm just using my thumb and forefinger, making sure that the camera can see that. And then I can notice if I use my thumb and forefinger, grab something, I can slide up and down. And I'm looking for this Aemulus-XR EA, and it's got our symbol on it, and just click. That's going to get us into the app. So to start, we just poke, press and release start. We've already got our organization name in there. Obviously, this may not come up if it's already been configured, depending on how your configuration is. And then you're going to put your student name in. You can just put your initials in if you're going through a demo. And it'll automatically assign you an ID number. And for right now, we're going to go to the training because that's going to walk us through exactly what we need to do. So we're going to go to training. And if the positioning of the casualty isn't quite right, you can turn your wrist over and you're going to see this menu. You can click on that and then hit recenter, and that's going to recenter them to your room. If it's not quite right, you can look into another direction, click that, hit recenter, and then you'll be able to position him so that you can work on him. So the first thing that you have to do is actually walk over to the casualty, and then you're going to have this "Are you okay?" Now, if I want to move this tablet around, again, I'm going to use my thumb and forefinger. I'm going to hold within the blue area, and I can move that wherever I want. Once I let go, it'll stay in position. So I'm going to ask him if he's okay. He's not.
No, I got shot.
Use the blue sphere to drag the casualty to safety.
And you can also hear in the headset that you're getting voiceover that's telling me to move the casualty to safety. You can also see up here on this hint bar, it says hint, use, grab the shoulders and drag the casualty to safety. So you'll notice again, I have this blue sphere here with a circle in it that's telling me that's what I want to grab. So I'm going to use my thumb and forefinger and grab him and pull him over to the target. So the first thing that it's asking me to do is to grab the IFAK. So I'm going to look at this blue hand. It's asking me to pinch that circle. I'm going to grab that, and now I can move it anywhere, and it's asking me to place it here right above him so I can use it. Again, obviously, the first thing I need to do, because there's a blue circle right here, is pinch and grab
the tourniquet high and tight.
Of course, I'm going to have to slide it over his leg, high and tight.
Pull the red tab of the
and
self-adhering
then start
band
to
to the blue
tighten
sphere.
it up. So the blue circle is telling me that I need to grab this red tab and pull it to the target. Once I reach that target, then I go back to the next target to secure it. Now I've got to turn the windlass 3 times. Now I don't actually have to turn it, all I have to do is pinch it. You'll notice it tightens that up. Now this eye is telling me that I need to look back here at my tablet so that I can continue. It says that the bleeding has stopped. If I look here at his leg, I can see that he's no longer bleeding, so that's good.
Route the self-adhering band.
Now I've got to route the self-adhering band up to the target.
Secure the windlass rod and self-adhering band Sharpie from the windlass safety strap to mark the time on the tourniquet.
And again, if you don't know what to do, you can look back up at the hints. It says use the Sharpie from the IFAK. So I'll grab this, and I'm going to mark the time.
Complete the multiple choice MARCH protocol quiz.
Now I have to do this quiz. MARCH.
Select the correct first intervention, blood sweep, from the 4 options.
Obviously, when you're not in training mode, this hint won't tell you exactly what you need to do yet because it won't be here. But in this case, I know exactly what to do. I need to hit the blood sweep.
Begin the blood sweep starting at the neck. Check your palms for blood after each section.
So I'm going to put my hands on his neck, look at my palms to see if there's any blood. There's not. The next section appears. I'm going to look at his arm. Nope, still no blood. And I don't have any blood. Up here where his wound is, I look this. Now I look at
Select
my
pack
palms,
wound from the
and I can
choices.
see that, yes, that shows blood on my palms. So this eye icon is telling me what's the next step. Now that I know that I've got blood, what do I need to do? If I don't know, look at the hints, select pack wound.
Expose the shoulder by tapping the shears.
So I've got to expose
Remove
the shoulder
hemostatic gauze from the IFAK and place it on the chest.
and then put hemostatic gauze into the wound. This will show me exactly how to do that. Now in this case, because this is for beginners, it's showing me exactly what I need to do.
Place your hands over the gauze for 3 minutes to apply pressure.
So I need to hold pressure on that until the bleeding stops. We've got a 3-minute timer here that's sped up. Obviously, we don't want to do this in real time. And it says, yes, the bleeding has stopped.
Take the battle bandage from the IFAK.
So now I need to secure that with the battle bandage. I can grab that out of the
Place the battle
IFAK
bandage
and
on
place
the
it on his
shoulder.
shoulder.
Continue the blood sweep. Check
Now I'm
in
gonna
your
continue
palms
the blood
for
sweep.
blood.
Look at my palms. Blood sweep. Look at my
Open
palms.
the casualty's mouth and look for anything blocking the airway.
There's also a quick setting. If you look at your palm and hold your thumb and forefinger together, that'll automatically recenter because I needed to get up here towards his head. Gonna open his mouth
Place your
up.
head near the chest to listen and look for breath signs.
Now I need
Look,
to put my
listen,
ear down to his
and
mouth
feel.
to see if there's any breath signs.
Grab the right wrist
Once
to
I've
put it
heard
behind
that,
the head.
it might take, 10, 15 seconds. There, he does have breath. So now I'm going to continue to put him use his right wrist to start putting him into position. So I'll do
Grab
that,
the left wrist to pull it across the body.
pull his arm over, pull his hip
Grab
over.
the patient's left knee to
and then
pull
put
him
him into
the
position.
recovery tourniquet to recheck it.
So now I need to recheck this, make sure that there's no bleeding. The bleeding has not resumed. Great.
Touch the wound packing to recheck for
Now
blood.
I need to recheck his wound pack. The shoulder is not bleeding either. Good. We're going to
Grab
hit
the green
next.
blanket and place it
So
on the
now we're going to
patient.
start hypothermia. So we'll put the blanket on him. Obviously,
Remove
in real
the blanket
time,
by touching the sphere.
the next thing I need to do is look to see if there's any more injuries. So I'm going to take the blanket off of him. It says, review the body for additional injuries. There, obviously, he's got a burn on his leg. So yes, there is an additional injury.
Grab the Curlex bandage from the IFAK.
I'm going to grab the Curlex,
Place the Curlex
put that on
the
his
burned
leg, and there are no more additional injuries.
Touch
So the next
sphere
thing I
to
need to
cover
do
the
is
patient
put
with
the blanket back
again.
onto him. This hand is telling me I need to interact with this sphere. That puts the blanket back on him. And now I need to fill out the mist report.
Use the Sharpie from the IFAK to fill in the front side of the report.
So the reason that it's gotten really big is because as we progress, the user's actually going to have to document those injuries. In this case, because we're for beginners, it's going to fill most of that in for us, but we can see what it's
Fill in the
supposed
back
to look
side
like.
of the report. Call for evac.
So now that the mist report is filled out, we can call the medic. And we'll hear the helicopter coming in. Obviously, that's not in real time either. But here he comes, or here they come to come pick him up. Once they've landed, then that part of the training is over. I can go back to the main menu and start over again and either do a different case, which is there's going to be more cases in here. Right now, there's just the one training case and the assessment case.